Okay, guys, so this is one of the most basic, classic, universal exercises. Literally today in the clinic, I saw a patient for the first day post-op after a rotator cuff repair and biceps involvement, and this was one of the main exercises I prescribed for the home program. It's called the Pendulum exercise, sometimes it's called the Codman exercise, and basically what I want you to understand, what I want you to see is, notice that the hips are making the arm swing. The goal of this exercise is to relax the shoulder entirely, allow the weight of the arm to hang down. Gravity is pulling down, creating some space in the glenoid, between the space of the humeral head and the glenoid fossa. So that little bit of kind of suction, that traction force that happens is because of the weight of the arm. It should be completely pain-free. You can see my body here is at about 30 degrees of flexion. As I go closer to horizontal, there is going to be more shoulder flexion, but it should all be passive. So typically this is going to be done about 20 to 30 seconds at a time. You could do circles. You can see here I'm going circular in one direction. You could do front to back, side to side. There's lots of variety in what you can do, but this is a very basic pendulum exercise, also known as a Codman exercise, typically done within the first 2 weeks following a rotator cuff repair surgery.